Welcome back to the WHHI-TV Daily News. Joining me now is Dr. Eric Gwynn, and he is with Coastal Carolina Hospital as a urologist. And so today we're going to talk about men's health, which I think is kind of interesting because I think there's a lot of focus a lot of times on women's health, but obviously men have some things they need to be aware of as well. So thank you for being here today, Doctor.
Thank you.
So we're going to talk about the enlarged prostate issue for men, and I know you have a new program at the hospital, so talk to us a little bit about that.
Yeah, so we have a new technology at Coastal Carolina called aquablation, which we've been anxiously awaiting to be able to treat our patients with enlarged prostates. One benefits of this could be more precise accuracy with resection of the prostate with quicker recovery times, less side effects to include urinary leakage or difficulty with erections or ejaculation after a procedure.
Well, that all sounds like those are good things. Less invasive, as always, words you'd like to hear. And how common is an enlarged prostate for men?
Enlarged prostate is very common. I think in some reports, up to 50% of men over age 50 are going to begin to experience it, and that number goes up with each decade of life.
Wow. Okay, that is a really pretty big number. And so what are some of the symptoms that people should be aware of?
Most commonly, men will complain of a lower or a slower urinary flow, getting up multiple times at night, excessive urinary frequency during the day, and in certain cases, urinary infections or blood in the urine.
Okay. And so I'm assuming that timely treatment is something that you want to jump on this right away if you start experiencing those symptoms, but why is that important?
Yeah, in general, once you begin to experience these symptoms, that's your body's way of telling you there's something going on. Left untreated, it can get worse to the point where maybe you can't urinate or you need to have a catheter and severely disrupt your quality of life. So earlier treatment is better to prevent long-term damage.
Certainly. And this is an issue that's completely separate from anything that would be cancerous with the prostate, correct?
Yeah, correct. So benign prostate hypertrophy, or BPH, is a separate issue than prostate cancer. Prostate cancer is something we rule out before we do any of these treatments because that has a different treatment modality.
Okay. And talk to us a little bit, you touched on it a little bit, but maybe delve into the benefits of this new treatment and how it's changing how you're treating your patients.
Yeah, so aquablation is bringing about some good changes in that the old-fashioned way of resecting the interior of the prostate used a thermal or electric current, which could damage the structures around the prostate for, again, those things we mentioned earlier, urinary incontinence or difficulty with erections. This is using a high-pressured water jet with just saline to resect the tissue. It's using no current, nothing of that nature. So the end result is generally a quicker recovery without all of the side effects that you could potentially have with a more invasive procedure.
And again, like I said, less invasive is always the words you'd like to hear. And I can tell that, this is something that you've obviously been studying and been doing for many, many years. How are you feeling about this new therapy for patients and what it will bring to their quality of life?
Very excited about it. Treating men with BPH over the years, as me and my partners have, we're always looking for what's a therapy that's less invasive, that gives a better long-term result, quicker getting back to the tennis court or the pickleball court. And I think this offers that to patients. A lot of them have already read about it and are interested in it. We've watched it for a few years grow until we understood it was very safe and good. And right now the patients are doing great, and we're very excited to offer it.
Well, thank you so much for being here today to share with us about this innovative new treatment. I think there's so many great things going on at Coastal Carolina, and this certainly is one of them. So Dr. Gwynn, thank you for being here today.
Thank you so much for having me.
Thanks to everyone on the show today for their insights and contributions. As always, our production team is behind the scenes to make all of this possible. And of course, we are honored that you have chosen to share a part of your day with us. I'm Betsy McDaniel, and we'll see you for the next WHHI-TV Daily News.